Welcome, everyone. Thank you for joining us today. My name is Dr. Wajid Ahmed. I'm the Medical Officer of Health for Windsor-Essex. Please continue to do your part to prevent the spread of COVID-19. Stay home if you're sick. Maintain a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve. Wear a mask when you cannot maintain a 2 meters distance from others. I will now report our current case counts. There are 129,923 confirmed cases of COVID-19 in Canada and 42,554 cases in Ontario. Chatham-Kent has 363 cases and Sarnia-Lambton has reported 340 cases. Michigan now has 103,710 cases with 13,699 cases in Detroit. Today we are reporting 2,541 cases of COVID-19, an increase of 4 new cases from yesterday. One is related to travel to Michigan, which is a non-work related. One is community acquired, and 2 are close contacts of a confirmed case. Overall, 26% of our cases are between the ages of 20 to 29 years, and 23% are between the ages of 30 to 39. 65% are male and 35% are female. 2,376 cases are now resolved and 91 cases are active and being followed by our health unit. 17 people are in the hospital with one person in ICU. Our community has lost 74 people to COVID. 52 deaths have occurred among residents in long-term care home and retirement home. Today we are reporting the death of a woman positive for COVID-19 in her 90s. She was a resident of a retirement home and passed away at the hospital. I would like to express my sympathies and condolences to the family during this difficult time. At present, there is one retirement home currently experiencing a COVID-19 outbreak, as well as there is one outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throats, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain. If you are feeling confused or losing consciousness, assessment and testing centers include Erie Shores Healthcare in Leamington and Windsor Regional Hospital Ouellette campus. Testing will also be available at the Sportsplex at St. Clair College on September 3rd and 4th. SOHAC in Windsor also offers testing for First Nation, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your result. To check your results, please go to www.wechu.org and click View Your Results to access the online test results portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at www.wechu.org for the most current information and case counts. This morning, I want to talk about mental health in pandemic. Pandemic doesn't happen all the time, but whenever it happens, it creates a number of challenges and can be really stressful for everyone. Fear and anxiety about an infectious disease that the world either has not seen before or an infectious disease that we do not have all the tools to fight against. This can be overwhelming and causes strong emotion in adults and children. We have seen many strong emotions in our community. Public health actions in these times, such as physical distancing, can make people feel isolated and lonely, and can increase the stress and anxiety. Public health actions are necessary to reduce the spread of the pandemic, but stress during an infectious disease outbreak can sometimes cause the following: fear and worry about your own health and the health of your loved ones. Fear and worry about your financial situation or job or loss of support services you generally rely on. Changes in sleep or eating patterns. Difficulty sleeping or concentrating. Worsening of chronic health conditions. Increased use of tobacco and or alcohol and other substances. worsening of mental health conditions. Focusing locally on some of the local challenges and work related to mental health, I want to acknowledge that this is September, which marks the 5-year anniversary of Suicide Prevention Awareness Month. The Windsor-Essex County Health Unit, in partnership with Canadian Mental Health Association, Windsor-Essex County Branch, and other community and health sector partners, has led this campaign to raise awareness about mental health promotion and suicide prevention in Windsor-Essex, and to spread the message that you are not alone. Given the global pandemic we all are living in, the stress, fear, and anxiety, this phase brings new and important meaning as we all struggle together through these new challenges. According to the World Health Organization, 1 person dies due to suicide every 40 seconds. In a recent national survey conducted in May of this year, 38% of the individuals stated their mental health has declined since the pandemic. 46% were feeling anxious and stressed. 14% were having trouble coping, and 6% had suicidal ideations. Locally, individuals aged 45 to 64 years old had the highest age-specific rate of death from suicide. Suicide is the second leading cause of death for youth and young children aged between 15 to 34 years old. We know that individuals will struggle with thoughts of suicide for long periods, sometimes for years. This struggle is often in silence due to stigma and fear. We need to come together as a community to talk about suicide and truly live the message, you are not alone, to reduce the prevalence of self-harm and suicide in our community. During Suicide Prevention Awareness Month, there will be many activities organized by the Suicide Prevention Coalition, including webinars, training workshops, and many talks. For example, this Saturday there is an event, Meet for Men's Mental Health, which will run from 1 p.m. to 5 p.m. at Lakeshore Oasis, 486 Advanced Boulevard. There are also several dates for ASSIST, Applied Suicide Intervention Training this month, and of course the annual Suicide Prevention Awareness Virtual Walk on the 27th. To participate and support suicide awareness in our community this month and learn more about activities and events, go to Canadian Mental Health Association's Suicide Prevention Awareness Month page, wear yellow, and let's talk about suicide. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AM 800.
Dr. Ahmed, just real quick here about the 2 close contacts. Are those close contacts added to the list from the community cluster that you mentioned yesterday?
Currently being investigated, Rob. I cannot comment on it. If there's any further update on the community cluster, we will provide that update at a later time.
With school starting next week, and going back to the cluster, I know all the cases didn't come from this house party, but just the spread of it and how quickly it spread. Are you concerned that if an individual or student gets it inside the classroom, it could spread fairly quickly inside a school?
That is one of our concerns, and that's why we wanted to paint a clear picture of what it means when people are thinking about having these isolated events, and how quickly this virus can spread among starting from one individual to many individuals in the community. So definitely, this is something that maybe many people understand, but there are others who may not truly understand the impact of it. So one purpose of that is to help everyone realize that why some of these messages are critical and why we want to follow those messages. And absolutely, when we are talking about these type of events, especially when we are thinking about what kind of transmission is happening in the community and how the disease is spreading in the community, because as a result of all those transmission in the community, it will have an impact on our children. And then these children, when they're going into the school setting, then it will have an impact in the school setting. So we need to focus on everything. When we're talking about different type of controls for school outbreak, the first thing is to manage and control the outbreak in the community, because that's the defining point. if there is a limited transmission or no transmission happening in the community, the likelihood of schools or children going into school and exposed to virus would be low. So we definitely want everyone to do their part, and that is why I've always said it, and I'll say it again, we're all in this together. We all have to do our part to make sure that we keep our communities safe. It's not the job just for me. It's not the job just for the health unit. It's not the job just for the school boards. We're all in this together. We all have to play our part and do the things that we are expected to do to keep everyone safe.
Thank you.
Any questions from Blackburn?
Yeah, just for tomorrow's epidemiological report, I'm not sure if you guys looked into the percentage of cases that needed hospital care over the course of their illness. Just a reminder that I was looking for that number for tomorrow. And also was curious if you guys are tracking or having information on lingering effects or health concerns after a person is considered clinically recovered.
Thanks, Maureen, for the reminder. I did pass that request to our EPI, and I hope to have that data that you're looking for tomorrow for our presentation. With respect to your second question, some of that information is tracked by Public Health Ontario, I believe, not necessarily at the local level, because obviously from a public health perspective, we are more focused on the case and contact management at the local level. But I am pretty sure that some of these long-term consequences studies are happening at a higher level, not at the local level. And we share our data with Public Health Ontario, with the ministry, and a lot of those things should happen from there. I'm not aware of anything that is happening locally just on that sense.
Okay, thank you.
Any questions from the Windsor Star?
Not at the moment, thank you.
Any questions from Windsorite?
Not at this time, thanks.
Okay. Any questions from CBC?
Yeah, hi, Dr. Ahmed. I know you've kind of gone through this already before, but when someone does call into the health unit, let's say, and they say that they've been to one of those locations or businesses that have had an exposure notice, what does the health unit tell them? Should they definitely get tested or self-isolate? Like, what's that conversation like?
So generally speaking, when we are identifying someone who visited a facility and we deemed that risk as low, which we have done with most of these exposure, I think almost all of these exposures. So any kind of low risk exposure, what we advise them, you just monitor your symptoms. At home, you don't need to self-isolate, but you need to monitor your symptoms. Any indication of you developing any symptoms, that's the time when you should go for testing. And the close contact who we deemed as high risk, generally speaking, we try to get all that detail from the case, and 99% of the time we get all those high risk close contact identified, and our team reach out to them. The recommendations for high risk contacts are for self-isolation, and if they are showing any symptoms, then the recommendation is for them to go and get tested. But generally, if someone is calling and if they say they visited the same place, which we have issued an exposure notification, we just advise them that the risk is low. We do some education. We tell them about what kind of signs and symptoms you should look for, and if you develop any of these signs and symptoms, then you should know. Then you should connect with your healthcare provider and get tested.
Okay, thanks. And then just another question. I know it's a little bit early for this, but Halloween costumes and candy are already being sold in stores, and we've kind of heard from some parents that they're a little bit concerned, I guess. Should families be preparing for a traditional Halloween these days?
That's a good question, and I would admit that I haven't thought about that yet, but something that we will keep an eye on, and maybe we'll share some messaging around that. But definitely, generally speaking, we do not recommend sharing items, whether we are talking about any toys or anything. So I think maybe some of the better options, even from a health perspective, what we recommend is, instead of maybe talking about chocolates or candies, maybe use some other type of incentives for children to enjoy. In the past, we recommended, or we have said that, maybe buy them a swimming pass or something, which would make them more physically active rather than just eating candies. So there may be some other recommendations we can look that we can provide for this specific pandemic times. And generally, I think sharing of any items is not recommended in this pandemic time, but we'll come up with more specific messages in the future before it comes. So thank you for that reminder.
Thanks, Dr. Ahmed.
Any follow-up questions from AM 800?
Just one, Dr. Ahmed, I'm not sure if my colleague got the same email here, but we received an email yesterday from a parent, and I know the board, the health unit is just making recommendations to school boards, but this parent is concerned, they have twins, and the twins are separated. Wouldn't it make more sense for the school boards to leave the twins in the same class to keep their close contacts minimum?
Good question, Rob. And as you rightly identified, that some of these operational details we do not make any recommendations because that's not our area of expertise. I think every business, every agencies are capable of running their entire operations, and I don't want to come out be an expert in how they should run their organization. But what I can tell you is the general principles that we have already talked about in terms of limiting the number of exposures, limiting the number of contacts. I think that would apply here as well. But again, I don't want to be the one to justify why they did what they did or why they're not doing what they're not doing. But that's definitely something that I would go back to the basic public health principles, that the number of contacts, if we can minimize, that's the recommendation that we have always provided, and we will continue to provide that recommendation.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Windsorite?
No, thanks.
CBC?
No, thanks.
Okay, thank you.
You.